had a second axillary dissection. She had 2 surgeries on her armpit. And we've presented data here previously, randomized data showing you do not need surgery on your armpit to remove all the lymph nodes because we know that radiation can take care of it and present with less complications in the future, less arm edema or swelling.
Yeah.
So she's done everything from a cancer point of view in a way to hurt herself.
Yeah.
And I sat there for an hour with her, and I just, unfortunately, couldn't make her understand that if she doesn't get the cancer treated, that whether she reconstructs the breast or not, it's not going to matter.
Mm-hmm.
So you talked about moral dilemmas. That's kind of a moral dilemma this week, and what to do with a patient that just doesn't want treatment.
Yeah.
Anyway, we're here at 212 Choices. 212 Choices, if you have questions, that number is 212-246-4237. 212-246-4237. Happy to answer your questions either on the radio or you can call afterwards. We also have free booklet and DVD to send to you if you wish. So I'm happy to answer your questions. Rob Spencer is here and answering all the questions with me. We're going to go to a word from our sponsor, and we'll be back shortly. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York.
News Talk Radio 710 WOR.
At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212 Choices, 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back. Hi, Rob. We're back alive.
Hi, Dr. Lederman.
During the commercial break, we had a phone call from a gentleman whose wife smokes a lot and is sick, and he wants her to get care, and she won't. So what do you do about that, Rob?
Well, you try your hardest to convince her to get care.
If she wants. I mean,
Right.
you can't make people do what they don't want to do.
Yeah.
So patients should do what they want to do. You try to present the data. He said that she smoked a lot. She was sick. She has Medicaid. Will we see her? And I said, yes, we will see her. Just call our number, 212 Choices, and we'll make an appointment and see her and see what's wrong with her. Try to get her better. But if she doesn't want to come, we can't make people come. But if she wants to come, we'll do everything we can to help.
Definitely.
So that's the best I can do. You can call day or night, and we're happy to make appointments for you or whatever is good for you. We saw another interesting man this week, which is another teaching lesson.
Mm-hmm.
Okay, sorry, but we have another call, so our system is we have to take this call. Good morning, this is Dr. Lederman, Radiosurgery New York. You're on the radio.
Good morning, Dr. Lederman.
Good morning, how are you?
Good. I don't know if you could give me some advice. I have a very good friend of mine who was diagnosed, I'm going to say probably in April, with pancreatic cancer.
Yes, sorry to hear
somewhere
that.
Somewhere between stage 3 and 4.
Okay.
It had definitely metastasized to his liver. And he ended up at Sloan Kettering, and he had some kind of, experimental chemo. And he had a CAT scan done a couple of days ago. And basically they told him some of the spots got smaller, some of the spots got bigger, and really it wasn't helping him, is what it came down to. He's a 58-year-old male. He was in excellent physical condition prior to this, no history of smoking. And we used to ride our bikes all the time, and he was like developing some back pain.
Mm-hmm.
And one thing led to another, and that's how he ended up finding out that he had this pancreatic cancer. I'm wondering, I know the prognosis on pancreatic cancer is very bad. I'm wondering, is there anything he could do to maximize his chances?
Well, there's a lot he can do. First of all, if the cancer, there's a lot he can do. Number one, if the cancer is growing, it means that the treatment's not working. So stop the treatment, first of all. A lot of people don't do that. They think that if they weren't on the treatment, the cancer would grow faster. No, that's not true. It's growing, so he should, based on what you told.
For some reason, I'm on your cell phone. You're breaking up a little
Well,
bit.
that's because the phones on WR are broken. So today only we have a special link to our patients, and we want to be able to speak to them. So I apologize for that. You can call me after the show on the same number, and you might hear better. But the point number one is if the cancer is growing, to stop the treatment. Number two, getting the CAT scan is good. Getting a PET scan is better for pancreas cancer, and there's cancer markers like CA19-9, and those also will correlate with the amount of disease. So just like a thermometer tells you what temperature it is, cancer markers will tell you how much the cancer's progressed. Number three, we have several unique programs for this patient, and program number one is to do radiosurgery, where we aim the beam works 90% of the time. So, for example, you were telling me that he was biking and having back pain. Well, most likely we can take care of that back pain because pancreas cancer grows into the celiac nerves. The nerves are very sensitive. As the cancer grows into the nerves, creates a lot of pain. So most likely, if he's still having the pain, we can get rid of that pain or have a high chance of getting rid of that pain. And number four, we have a unique system where we actually will biopsy the cancer. We will then grow the cancer cells in a laboratory and test it with many, many different agents, different kinds of chemo and other agents, and find a custom-made treatment for him. So most hospitals, when you go and have pancreas cancer, you get the same treatment. If you're the first patient or the 1,000th patient, probably every patient in between gets the same treatment. With us, the patient gets custom-made treatment that's custom designed for the patient, and it's predicted to have a much higher success rate than just the usual. So if he wants to get hooked up with us, he should call back either after the show or during the week, and we can see him. I can explain more to him and get him involved in a program that probably is more designed for him specifically and not for every other patient in the world with pancreas cancer. Okay. Okay, I'm going to hang up, but call us back at 212-CHOICES if you have other questions. 212-CHOICES. Thank you. Okay, I'm sorry I missed someone's call, but again, the phone systems are down at WOR, and I'm using an alternative method, and that's why the phones are a little bit more difficult than usual. But if you have a question, please call us either during the show, and I'll answer it, or after the show. That number is 212-CHOICES, 212-246-4237, 212-246-4237. And actually, the patient I was going to talk about is a patient with pancreas cancer.
Oh, good.
So this is a man whose family I know. But sorry, we have another caller on the line. Radiosurgery New York, 212 Choices. You're on the radio.
Yeah, I wanted to ask the doctor a general question.
Okay, go ahead.
Okay, the question is this. Is the only bad side effect of general radiation the fact that normal tissue is harmed? Is that the only real problem?
Well, that's like saying is the only harm of a nuclear bomb that people die. You know, the whole idea of radiation is to protect healthy tissues. You know, we can go in and radiate the whole body, but radiating the whole body is lethal, and radiating healthy tissues is lethal. And I know I did the original work showing that, for example, if you have certain kinds of cancer and you get your heart radiated, you're going to increase your death rate by 20%. So radiating healthy tissues is really very, very, very lethal and unnecessary for most diseases in this day and age. That's why we brought radiosurgery. We were the first in America to bring radiosurgery, and it was revolutionary. It still is.
And with radiosurgery, where you target only the cancer, is there any side effect in that case where you're preserving good tissue?
Well, there's much less side effect. You know, usually for most people who get radiosurgery, most people, you can never say 100% in medicine, but for most people, no. They tolerate treatment well. And for most people who come in, they don't even feel they had a treatment. There's not hair loss or nausea or vomiting or fatigue. We can treat tumors as small as the head of a pin, and sometimes we do. And sometimes we treat tumors, the biggest tumor we've treated is 6 liters. So if you imagine 6 liters of milk or Coca-Cola, it's a lot of tumor. So we have a lot of versatility, and you can never say always or never for everything, but I can tell you that usually if you hit the cancer and avoid healthy tissues, it makes a lot of sense. It helps your body. And we want that patient to live a long time. We want them to get back to their normal life, or we want them not to take away from their normal life. And I tell people it's like a plum in a bread box. Radiosurgery allows us to treat the plum, which is the cancer, without hurting the bread box, which is your body. And healthy tissues never benefit from radiation. So in general, we're not trying to treat the healthy tissues. We're trying to keep the patient intact.
Well, with radiosurgery, do you get zero effect on healthy tissue or just small effect on healthy tissue?
Well, it's usually 0 to small. Again, we're talking about, remember, I've treated 20,000 patients, so we're talking about big tumors, small tumors everywhere in the body. And each case is different. But I can tell you that if you think about the cancer as a plum and the bread box is your body, would you rather have the plum radiated or the bread box radiated? And that's the whole idea. We're trying to diminish the volume of tissue treated. Just like in surgery, if you do less cutting, you're going to have less complications, right?
Yes.
And if you radiate less tissues, you're going to have less complications and less late effect. Like the woman I talked about earlier, who's at a hospital right now, or doctors are telling her to get her whole brain radiated when the tumor's only 5 centimeters. So there's huge differences in approach.
First in the Western Hemisphere, does they do it elsewhere in Europe?
We were the first ones in the Western Hemisphere with body radiosurgery. We brought this technology from Sweden. We were the first ones to do it. We've treated about 20,000 patients with body radiosurgery. We have a whole team that's devoted. We do all other kinds of things as well, but it's nice to know that your team is devoted to keeping your body intact. And look, when we sit down with a patient, we give them all the options. They can have standard therapy or radiosurgery, or maybe they don't even need any treatment. I had a woman come that I told you with a mass in her groin. I was sent for radiosurgery this week, and we did the analysis, and we found that she could just have the tumor removed, and she had the tumor removed in half hour, and she's home free today. So there's always options, and it's better to have the options in your hand than have no options.
And you could be the primary doctor. In other words, if someone has an issue, they can come to you directly. They don't have to be referred by anybody else.
That is correct. That's what happens to most people. They come directly because they want a fresh second opinion. They want a new way of looking at their cancer that they haven't heard about before. That's what we try to offer. We try to offer new options.
Do you do all the imaging there, or do you send out to someplace?
We send out to the best place. We use the best people, and we have incredible radiologists that we work with. We've had several on the program before, but we have incredible radiologists